screen, I just want to ask one question to our audience. If you could raise your hand or drop a message if you know someone, or if you yourself or you know someone who struggles with pain. Thank you. So I think the presentation should be up soon. Let me know if you're able to see my screen.
Yes.
Full screen. Perfect. So it's not just us. A lot of people are suffering with chronic pain. In fact, in the US, it was rated to be around 126 million. But what is more important is that after decades of back and forth, the World Health Organization also sees that chronic pain is a disease and it needs to be managed in a multimodal fashion. So today I will take an opportunity to introduce to one of our members, Jessica. She was kind enough to let me share her story. So Jessica is a mom in her early 40s. She's a mom of 3. She has severe knee osteoarthritis and back and hip pain. When we met her, in fact, she was struggling to sit for even 2 minutes during the 30-minute call. So she had to take a break. And she is quite an extroverted person. So she was feeling socially isolated because she was not able to spend time with her friends anymore because of this much pain. And her doctor frequently told her, no, just lose weight. No, you're too young for joint replacement. But sometimes, the doctor's visits are too short and the advice is too quick for a person to implement it over a period of time. Because we might be visiting a doctor for like 10 minutes, but we have to live with ourselves for the next 14, 30 minutes of the day. So that's the difficult part we have noticed. And this is the story of many people. Our healthcare systems lack the infrastructure to help a person, for example, like Jessica, manage her pain constantly, beyond pills and biologics. Sometimes it's often confusing. In fact, she used to visit her physiotherapist. In 1 year, she visited 64 times, and she changed 3 physiotherapists, and it really cost her a lot of money. So when we interviewed a lot of members, over 150 interviews that we have done, we realized that people are spending on average $6,000 out of pocket, and still they are struggling and suffering with pain. So the solution to this, we paired Jessica with a health coach who has a background in physiotherapy. So they are licensed physiotherapists, but also is trained in behavioral coaching. So they understand motivational interviewing, understand the underlying motivations, so they can apply science-backed behavior change techniques. We tried to improve the pain and health literacy, but the most important goal that we identified for a person like Jessica was, how can we help her increase her physical activity without making it a burden for her? And how can we guide the person constantly towards making healthy choices? So it's more about free will and less about giving advice. And after 8 months with us, Jessica, as of today, she actually finished a year with us. She has lost 120 pounds in weight. She stopped thinking about, do I need to get joint replacement? Instead, she went for concerts. She's going hiking this summer to waterfalls. So her pain is really down. And she never visited a physiotherapist all of last year up till this day. Never. All of this was done fully virtually with another person who is in a completely different time zone from her. So, and we ran this not just with Jessica, we had about 25 other members who had chronic knee, hip, or back pain. And our initial experiment was more catered towards consistency. Are you able to exercise more frequently? And we realized that through our approach, they were able to exercise 3 times a week, 24 out of 26 weeks. So we ran it for 6 solid months. Versus if you're in other self-managed programs where you just receive a prescription, you don't see the physiotherapist for 4 to 6 weeks, probably people are dropping off. Physiotherapy drop-off rates are very, very high. So the way it works is that we have a short onboarding process where Jessica can pick a coach that she gels well with. And then after that, there is a detailed assessment, both behavioral and health assessment, which after that is done, she will meet with a coach for a 60-minute kickoff call where they try to identify the goals, health goals, life goals, so that we can align on what are the next steps to take. And once these meetings are done, we give Jessica access to our application preloaded with the program and also access to the coach, asynchronous access. So you can send a message, and if whenever the person is available, they'll give a response. And we have basically a good feedback loop. We have seen, people exchange up to 150 to 200 messages a month, and they get quite valuable feedback from the coach. So whom have we worked with? Let me put it that way. So we see that people who are living with joint osteoarthritis, rheumatoid arthritis, which are top conditions also in Canada where we are located, just because of the colder weathers. We have worked with people who have fibromyalgia. In fact, one of our coaches also has been living with fibromyalgia for the last 20 years. We have worked with people who have chronic MSK pain from degenerative disc disease or a history of motor vehicle accident that has not resolved. And we also have worked with people who have pre or post-op rehab so that they are able to have a steady pace and recover slowly. And a lot of times, when we are doing preventative work, we also see that they would have some form of chronic cardiometabolic or respiratory conditions also. So our coaches are also trained to understand these kind of issues so that they can cater the level of physical activity that can be given to them. So this is a short slide where, what is the real background of the coaches? How do we do this vetting process? So we are very, very picky with the kind of people we try to take, because the coaching that's required for people who are suffering with pain is not the same as someone who wants to become an Ironman athlete. So a lot of times, people confuse what coaching is, and that's where there's a friction. So we try to bring people who have a background in physical therapy, who have a background in social work, so who understand, what's the psyche, what's the environment they have, how they live their life, how are they impacted by their pain. And we also make sure that they have a background in motivational interviewing. They understand how to motivate the person, the underlying motivations and grit of the person. We also have a preference towards working with people who have chronic pain because they have that lived in experience, and there's higher likelihood of someone basically able to progress much better. So what we really see, the long-term vision, is that the synchronous and asynchronous care needs to be bridged. And we see Anooka becoming that bridge, because health coaching is fast evolving to be that bridge. And so much that there are category 3 reimbursement codes from CMS. They have seen the value of health coaching in diabetics and weight care. They have seen the value. There are a couple of bills in Senate that would approve for use of HSA or FSA money towards health coaching. And there are 50 plus clinical studies. In fact, there is a big study that was done in UPMC. They have a program called RxWell. It's a very well-known initiative where they had over 10,000 members who got health coaching for managing their weight and diabetes. So there's a lot of evidence that backs this. And we see that with Anooka, we can make the bridge to help people who are living with chronic pain suffer less and enjoy their life. So I'll be happy to take on. This is my lovely team. So I have Rodrigo. He's in Germany. He has a lot of expertise in natural language processing, developing a lot of cutting edge application. We have 3 physicians. Dr. Kedar is one of my good friends. We both actually built products together at the hospital previously. And Dr. Rachna is a psychiatrist, and Dr. Ravi has been there with us since day one. He himself has a health coaching business, so he gives me a lot of sound advice on being scientifically grounded and gritty as a founder. And I'll be happy to take on any questions you have. And thank you, being a very kind audience.